शुद्ध देसी रेडियो शुद्ध देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो शुद्ध देसी रेडियो.
Hello, everyone. My name is Shivam Gupta, and I am here with my colleague Aditi Satgare. We are members of the Global Thrombosis Forum, a nonprofit organization that promotes the awareness of thrombosis in the community. Today, we will be discussing the relationship between fat intake and thrombosis, as well as more useful information.
Thank you for the introduction, Shivam. From my research, thrombosis is the formation of blood clots. I know that there is so much more to know about blood clots, so can I ask you a few questions?
Sure. I am excited to answer your questions and talk about thrombosis and how it relates to fat intake. Let's get started.
First, can you explain why VTE and obesity are important to be concerned about?
Of course. VTE, which stands for venous thromboembolism, is the third most common cardiovascular disorder after a heart attack and stroke. Obesity is a major public health problem not only in the United States, but also rapidly is becoming a global threat.
That sounds interesting. Please tell me more about VTE.
It is estimated that VTE occurs among 1 to 2 per thousand people annually in the United States. It imposes a substantial burden on the U.S. healthcare system. The initial clinical management, recurrence, and long-term complications of VTE compromise quality of life. It costs the healthcare system in the United States about $15 billion annually.
Oh my gosh, this is very scary. What's the deal with obesity?
Obesity is a major risk factor for some diseases, such as high blood pressure, heart disease, diabetes, stroke, depression, and VTE, and its incidence is very high.
What are the causes of obesity?
There are actually many factors that contribute to obesity. Some of them are a lack of exercise, excessive intake of food, and meals that contain high fat. Foods with high cholesterol may trigger the production of plaque, a fatty substance that could obstruct blood vessels. Individuals who have already suffered from heart problems generally have a high level of factor VII, a protein that contributes to blood coagulation. Eating foods high in fat correlates to a higher risk of obesity.
Now, since we have the basic information about our topic, obesity, let's continue on to my next question. What is VTE?
Great question indeed. The VTE, or venous thromboembolism, is a very common vascular disorder that can lead to significant mortality. This is when there is a presence of blood clots in the veins. VTE encompasses two conditions, namely DVT and PE, pulmonary embolism.
So how is obesity related to VTE?
Well, actually, obesity increases the chances of someone getting VTE. DVT, or deep vein thrombosis, usually occurs in your deep veins, which are located in your legs or pelvis. If that blood clot starts moving up through your veins and into your lungs, it results in a PE.
So is DVT a fatal condition?
DVT does not cause any immediate death, but if it becomes PE, then it can be lethal. This is the reason that any patient who develops DVT must be treated promptly.
Okay, now that I know a little bit about DVT, I'm wondering if DVT could be prevented.
Of course, DVT is one of the most important and common conditions that could be prevented by simple techniques.
Can you tell us some of those techniques?
There are many ways to prevent DVT, and some of them are very easy. One way is to drink more water, at least 1.5 liters per day minimum for an average adult. Another way is to walk around frequently and take frequent breaks from driving and at work on a computer. You should also exercise regularly and eat a healthy diet using the tips to get the right types of fat.
So how do I avoid obesity?
Good question. The dietary recommended intake for fat in adults is 44 to 77 grams per day, or about 20 to 35% of total calories from fat. For a 2,000 calorie diet, however, there are many types of fat, but not all are good.
I have heard a lot about the good cholesterol and the bad cholesterol. I'm really confused. Can cholesterol really be good?
Let me make this a bit easy for you. Saturated fat is generally solid or waxy at room temperature and comes mostly from animal products, with the exception of tropical oils. Taking in too much saturated fat is linked with raising levels of bad fat or low density proteins or LDL cholesterol in the blood and increasing internal inflammation. Healthy adults should limit their saturated fat intake to no more than 10% of total calories. Trans fatty acids, also called trans fats, are formed when a liquid fat is changed into a solid fat through a process called hydrogenation. Many manufacturers use hydrogenated oils as an ingredient because it extends the shelf life and consistency of foods. Trans fat will raise high levels of bad LDL or low density lipoproteins cholesterol and decrease levels of good HDL, high density lipoproteins cholesterol. So you can see that our diet plays a very important part in keeping the balance between LDL, HDL, and the development of obesity.
So what role does cholesterol play in these events?
Cholesterol chemically has a steroid ring and is made by the liver. Therefore, only animal-based foods contain cholesterol. A high intake of saturated fatty acids and cholesterol is associated with a high incidence of occlusive arterial lesions involving both atherosclerosis and thrombosis. If cholesterol levels in the blood are normal, you should limit your intake to 300 milligrams per day. If you have been diagnosed with high cholesterol, you should limit your intake to less than 200 milligrams per day.
So what about unsaturated fats?
These fats are usually liquid at room temperature. Sources include monounsaturated and polyunsaturated fat. When used in place of saturated fat, they help lower cholesterol levels. Monounsaturated or good fat comes from plant-based sources and includes olive, canola, and peanut oils, nuts and nut butter, olives, and avocados. Some of the polyunsaturated or not good fat come from plant-based sources and include safflower, sunflower, corn, soybean, and cottonseed oils.
I heard that Alaskan krill oil is beneficial for patients with elevated LDLs. Is that true?
Yes, of course. The krill oil in the form of gelatin capsules is routinely used to manage elevated cholesterol levels.
So what is the relationship between fat intake and weight? Oh, sorry.
Oh,
Is it safe to take fish oil supplements?
wait, should we pause? Go.
Is it safe to take fish oil supplements?
Replacement of dietary saturated by unsaturated fatty acids generally lowers cardiovascular morbidity and mortality. Consumption of fish oil or fish oil concentrates, as well as for vegetable oils, rich in oleic, linoleic, and alinoleic acids, reduce the incidence of VTE. Using procedures such as angioplasty involves putting a stent, and surgeries involving coronary artery bypass grafts or CABG, fish oil treatment has been shown to have a beneficial effect.
So what is the relationship between fat intake and weight?
Being overweight may increase the risk of developing high blood pressure, diabetes, cardiovascular diseases, or diseases of the heart and blood vessels, and certain forms of cancer. Therefore, it is important to lose weight if you are overweight. A diet high in fat can lead to weight gain.
This is great information, but how do I know if I'm obese?
One way obesity can be diagnosed is by calculating your body mass index or BMI. It is a relatively simple calculation. It is calculated by dividing a person's weight in kilograms by their height in meters squared. It is a marker of excess weight and correlates well with body fat content in adults. It is generally used to classify whether someone is underweight, healthy, overweight, or obese.
That sounds like a good way to measure obesity. I heard that there are ranges that correspond to different categories. Can you explain those too?
Sure. Generally, if an individual's BMI is greater than 30, they would be considered obese. If it averages between the 25 to 30 range, they would be considered overweight. Furthermore, if an individual has around 18 to 25, they would be healthy or average. If the BMI is less than 18.5, the individual is likely considered underweight. Calculating this can help doctors understand at what risk if someone is to specific illnesses like obesity and is instrumental to a healthy lifestyle.
So how is obesity related to VTE?
Obesity is an independent and moderate risk factor for VTE. The risk increases with body mass index, age, and the presence of other acquired risk factors. Several clinical studies have found that obesity is a risk factor for VTE. You see, there is a chain reaction. Diet resulting in obesity, obesity resulting in the development of plaques in blood vessels, and plaques then resulting in VTE. Everyone under the right circumstances and risk factors can get VTE. African Americans have the highest chance of getting VTE, followed by whites, Hispanics, and then Asians.
So how does obesity produce an increased risk of VTE? I'm not really clear on this aspect.
Well, you are not the only one who has difficulty understanding this complex topic. This is indeed a very difficult topic. In simple words, obesity promotes chronic inflammation and impaired fibrinolysis, clotting process, both of which lead to an increased risk of thrombosis. Coagulation and fibrinolytic activities are under strong genetic control. Intrinsic coagulation factors and impaired fibrinolysis predispose obese subjects to thrombosis.
I heard that a very large Danish trial was conducted that gave us a lot of positive input in understanding the conditions. Could you please provide me with some information on this trial?
Sure. This was a Danish prospective study. Here are the salient points from the trial. The data was collected from 57,000 people aged 50 to 64 years old. There were 27,000 males and 30,000 females approximately from the years 1993 to 1997. It collected measurements such as body weight, BMI, waist circumference, hip circumference, and total body fat. And here are the results. An increase in hip circumference correlated to VTE in women. An increase in waist circumference correlated to VTE in men. All measurements of obesity are predictors for the risk of VTE, and obesity was associated with venous thromboembolism, VTE. Even though the study was conducted several years ago, the results and conclusions are still valid today.
So I learned a lot from your input, and now I know how fat intake is directly related to thrombosis. Let me conclude from our discussion what the summary is. We came to know the relationship between body weight, fat intake, and blood clots. We found that obesity can increase the risk of thrombotic conditions occurring in the population. Our message to the public is to make sure to maintain a healthy lifestyle so that one does not get obese and have a higher risk of blood clots. If we can stop one blood clot, we can save one life. Did I summarize this properly?
Aditi, I consider myself to be an expert in this subject. Haha, and I must say that we could not have done this any better.
देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो